At this time, I would like to introduce the members of the Canadian Human Rights Commission, including the interim chair, Charlotte Ann Melisheweski. If she can come up on the stage and introduce the other members of her team.
Thank you so much, and thank you to all the organizers who have made this event possible. I want to congratulate the Autism Alliance of Canada on your 10th Annual Leadership Summit. It's such a landmark to reach, and I feel very fortunate to be part of it here today. I'm happy to be joined today by my colleague Carleen McGinty, who will be up shortly. Carleen's the manager of a small but mighty team at the Commission that monitors how Canada is implementing its international human rights obligations. Je voudrais aussi rendre honneur à tous les territoires autochtones qui sont représentés ici aujourd'hui. Je suis honorée d'être ici en territoire traditionnel non cédé de la nation Algonquin-Anishinaabe, dont la terre et les eaux sont aussi appelées Ottawa. En tant que groupe qui défend les droits de la personne, nous devons absolument axer en priorité nos activités sur la réconciliation et la décolonisation. Par conséquent, nous intégrons très humblement ces principes à tout ce que nous faisons et dans toutes les conversations comme celle-ci. J'occupe le poste de présidente de la Commission depuis plus d'1 an et j'en suis vraiment très honorée. The Commission's mandate to advance the rights of everyone in Canada, especially those with disabilities, is very close to my heart. I grew up witnessing the barriers my mother had to face in a world that was not built for her, a world that all too often failed to recognize her pain, and it compelled me to work hard to help break down as many of those barriers as I could for her and for others. I think that's a calling that most of us in this room share. With that, I will begin by sharing a few words on the role of the Commission in protecting and promoting the rights of people with disabilities in Canada, including people on the autism spectrum and their families. And then I'll turn it over to my colleague Carleen to walk us through a new tool that we hope will be helpful to all advocates and researchers here today. It's a tool the Commission has developed in collaboration with the Federal Housing Advocate and with the engagement of many disability advocates across the country, including the Autism Alliance of Canada's own Dr. Jonathan Lai. First, a few words on who we are. En vertu de la loi canadienne sur les droits de la personne, la Commission agit en tant qu'institution nationale des droits de la personne. Nous sommes indépendants du gouvernement fédéral pour remplir notre mandat de protéger et de promouvoir les droits de la personne au Canada. Nous soutenons la défense des droits de la personne au moyen d'études et d'élaboration de politiques. Nous faisons entendre nos voix, nous sensibilisons, nous conseillons les parlementaires et nous travaillons en étroite collaboration avec les détenteurs des droits et les intervenants. De plus, nous surveillons ce que le Canada fait pour appliquer les lois internationales sur son territoire et nous faisons rapport à ce sujet. But perhaps what we're best known for is our role in receiving and assessing discrimination complaints from people across Canada who work for or have received a service from a federally regulated organization. That could be a government department or agency, or a federally regulated institution in the private sector like a bank, an airline, or a telecom company. Our role in receiving and assessing complaints means that each year we help thousands of people find the help they need, often without having to file a formal complaint. Sometimes that means connecting people with other complaints mechanisms at the provincial level or with their unions. But if a complaint is about a federally regulated organization, and if the person can link their negative experience to one or more of the 13 grounds of discrimination in the Canadian Human Rights Act, one of which is disability, then we can accept their complaint into our process, and then we help the parties try to resolve the matter. Often we're able to resolve cases through mediation, and other times we refer complaints to the Canadian Human Rights Tribunal for further inquiry. The tribunal is a separate organization that operates like a court. Only the tribunal can rule that the discrimination has in fact taken place. In complaints that we refer to the Canadian Human Rights Tribunal, our lawyers regularly show up to represent the public interest on human rights issues that could have a very broad impact on many. So how might this be useful to people on the autism spectrum, their families and support people and advocates? The opening words of the Canadian Human Rights Act calls for a Canada where everyone, and I quote, should have an opportunity equal with other individuals to make for themselves the lives that they are able and wish to have. And that's also key to realizing the Autism Alliance of Canada's vision, a Canada where people on the autism spectrum have equal rights and opportunities for full participation and acceptance in Canadian society. We owe so much to the many decades of activism and advocacy of Canada's disability rights movement. Over the last many decades, public awareness and understanding of disability issues has deepened and expanded, and thankfully so. People have more knowledge now of disabilities that are less visible, chronic pain, mental health, and neurological differences that impact how we learn, how we communicate, how we process emotions, and even how we understand the world around us. But even with greater public awareness, discrimination and ableism persists. The ground of disability is the most cited ground of discrimination in the complaints we assess. It represents 52% of the complaints we accepted over the last 5 years. And consistently, a significant portion of those complaints are related to mental disability. Last year alone, 40% of the discrimination complaints we accepted under the ground of disability were related to mental disability. That represents 19% of all complaints. That's a significant amount of reported discrimination. And there's so much more that goes unreported, unchecked. It's why the Commission has been working hard in recent years to ensure that our complaints process is not another barrier to accessing justice. There's more work to be done, and we continue to benefit from engaging with people with lived experience, advocates and researchers like all of you, to inform our work. We've redesigned our online complaints process at every step so that it's easier to navigate. With this more intuitive step-by-step online process, our hope is that what is a complex legal process is now more accessible for everyone. In addition, what has always been true but bears repeating is that you can file a discrimination complaint on behalf of someone else, on behalf of a loved one, a friend. Of course, a Canada where people on the autism spectrum have equal rights and opportunities for full participation and acceptance in Canadian society is about more than just being able to file a complaint after the fact. It requires the proactive removal of barriers so that a human rights complaint doesn't have to be filed in the first place. It was with that aspiration in mind that Parliament created a proactive human rights law in 2019, the Accessible Canada Act. I'm happy to say that we have Canada's Accessibility Commissioner with us today, my colleague, Mr. Michael Gottheil, who many of you may know and whom I hope you will have an opportunity to meet during this conference. Michael is responsible for promoting and enforcing compliance with the Accessible Canada Act, ACA as we call it, and its regulations, which came into force at the end of 2022. Under ACA, all organizations under federal jurisdiction must create concrete accessibility plans to ensure they take steps to identify, remove, and prevent barriers to accessibility. So much of what we're talking about at this summit is at the core of what Michael's team is all about and what guides us all. The understanding that accessibility is a fundamental human right, the belief that when everyone can participate, everyone benefits, the knowledge that innovation is essential to creating an accessible Canada for all, that it will take creativity and imagination and new ways of thinking and doing. This includes eliminating stigma and paternalism towards people with disabilities. So it's great to have Michael here today as we talk about the way forward in innovating towards a barrier-free Canada. And of course, one of the biggest barriers to equality right now for people in Canada with disabilities is housing. This issue has been front and center in our work this past year in our role as the federal organization responsible for monitoring Canada's fulfillment of its obligations under the United Nations Convention on the Rights of Persons with Disabilities. We'd been doing this type of work for years before it was made formal by Parliament in 2019. And most recently, this engagement has informed our newly launched monitoring framework on the right to adequate housing. This is the tool I was telling you about earlier. This framework has been a shared labor of love from so many. And it's being launched at a time when Canada is at a crossroads in its housing crisis. We must ensure that nobody is left behind. It's a key priority for the Commission, and it's a key priority for my colleague, the federal housing advocate, Marie-Josée Houle. It's also a key priority for the Accessibility Commissioner, Michael Gottheil, and I know it is a key priority for each of you. In the Alliance's 2022 policy brief, Housing Through Autism Lens, you put it so powerfully. You refer to the double cliff in the lifespan of adults on the autism spectrum where significant housing vulnerabilities arise. You described how, and I quote, "The first cliff is at the transition to adulthood due to lack of access to affordable housing. The second cliff is at the transition from midlife into later years, when there is a need to sustain housing, when the original primary caregivers are no longer able to provide support, and where a broader circle of support is lacking." C'est pour cette raison que la Commission a abordé la tâche d'élaborer ce cadre de surveillance en ayant conscience de la grande diversité au sein de la communauté des personnes en situation de handicap d'une part, et des besoins et des identités intersectionnelles des personnes que nous avons la responsabilité de servir. Nous devons nous assurer que la défense des droits reflète fidèlement la réalité. C'est pour cette raison que votre travail demeure aussi inestimable qu'à vos débuts en 2007. Depuis 17 ans, vous existez pour provoquer des changements et faire de la sensibilisation, pour contribuer à construire un récit autonomisant pour et avec les personnes sur le spectre de l'autisme et leurs familles. The Canadian Human Rights Commission is right here with you. Our organizations may play different and distinct roles in the human rights journey, and we may not always be able to follow exactly the same path, but the Commission will always be here to listen, to learn, and to amplify your voices. That's what this new framework is all about, and here to take us through it in a bit more detail, my dear colleague, Carleen McGuinty. Thank you. Merci.
Good morning. So as Charlotte Ann said, I'm Carleen McGuinty with the Canadian Human Rights Commission. I am very excited to be with you this morning because we have just launched this work on this monitoring framework on the right to adequate housing for people with disabilities. So I'm very proud of the work. I'm happy to share it with you today, provide you with a quick overview, and give you a sneak peek at some of the preliminary results that will be made public over the next few weeks. Okay. So what is this framework? What is it all about? So it's really an accountability tool that aims to track Canada's progress in implementing the right to adequate housing for people with disabilities. Canada signed on to the Convention on the Rights of Persons with Disabilities. They've committed to protecting the right to housing for people, and now this tool is going to help us track if progress is being made. So we've just started that process of tracking. It's also been a collaborative project. As Charlotte Ann mentioned, this is work we're doing as the national monitoring mechanism for the Convention on the Rights of Persons with Disabilities, but also in partnership with the Office of the Federal Housing Advocate. It's been an exciting time and a challenging time to bring these two worlds together. There's no off-the-shelf tool that was available to us to track these things, so we've had to create something. And we've done that in consultation with experts, people with lived expertise across the country and from various backgrounds. And we've made it to fit Canada using data sources that are available to us now, and also keeping an eye on what data is unavailable and that we should be pushing for. The last thing is that we have been working with people with disabilities and people with lived experience of homelessness and housing insecurity throughout the various steps in this project. Donc, pour arriver à notre cadre de surveillance, il y a eu un engagement continu à chaque étape du processus. J'aimerais juste miser sur 2 exemples. D'abord, on a fait des entrevues d'informateurs clés pour avoir la perspective de différentes personnes et de différents types d'handicap. On a eu la chance de parler avec le Dr. Jonathan Lai pour avoir son perspective. On a aussi organisé un événement qu'on a appelé les cercles d'apprentissage. Ça nous a donné la chance d'entendre les expériences des personnes en situation de handicap qui ne sont pas souvent à la table pour discuter de ces choses. Et ça a été très important pour nous et a informé notre travail. I'm going to speak to this slide very briefly, but the approach we've taken to the framework is a holistic approach that's rooted in human rights. So we're tracking housing rights, but we're not just tracking bricks and mortar. We're looking at everything that goes around housing. And while we know we want to measure resources and we want to measure policy efforts, which are really important, we've only had resources at the moment to measure outcomes. So what are the results? What is it looking like on the ground to realize the right to adequate housing for people with disabilities? So here are the 11 areas that we are tracking. So on the slides, you'll see icons for these 11 areas that we've arrived at through consultation. And if you go visit our website, and I'll give you the link at the end, you can click on each of these and you'll get more information. So we're going to be tracking affordability, location, accessibility, cultural adequacy, supports and services, discrimination and dignity, homelessness, security and safety, institutionalization, safety, and habitability. Sorry, one was security, supports and services. My text is very pale here. Donc, quelles données utilisons-nous pour arriver à ce projet de surveillance? Bien, pour nos indicateurs de résultats, nous nous concentrons principalement sur les enquêtes nationales qui sont à notre disposition, surtout l'enquête canadienne sur l'handicap et l'enquête canadienne sur le logement. Mais il y a plusieurs autres enquêtes nationales qui existent. Et les données que nous avons présentement nous offrent vraiment une perspective sur le logement pour les personnes en situation de handicap. Et les données qu'on a en ce moment nous donnent la chance de faire une comparaison pour les personnes en situation de handicap comparées les personnes sans handicap au Canada. We'd really like to have disaggregated data and recognize how important that is, but we don't have the resources at the moment to pursue disaggregated data. So I'd like to take a couple minutes to walk you through some of the areas that we have on our website and some of the preliminary findings, and I'll be quick because I know we're almost out of time. So if you were to click on the accessibility icon, you would see this. We have actually 6 outcome indicators. This is the first indicator where we're measuring the percentage of people with disabilities who have housing that meets their accessibility needs. It will describe the outcome indicator, and it will give you a list of all the available data sources that are out there that we're aware of to measure this. So here's what we found at this early stage, which isn't surprising, I'm sure, to any of you in this room, and that is that housing is not meeting the accessibility needs of people in Canada. And so in 2022, 16% of people with physical disabilities said that their homes didn't have the physical aids they needed. Now, these numbers don't tell us the whole story, because this survey is only asking people with physical disabilities if their housing is meeting their accessibility needs. So that means that autistic people, for example, are not asked that question. So we're not getting the whole picture, and we recognize that this is a significant gap in the data. Affordability, same thing. You were to click on the affordability icon, you'll see everything that we'd like to track in this area. And affordability is measured as 30% of your household income or more spent on housing. Preliminary findings for affordability are that people with disabilities are more likely to live in unaffordable housing than people without disabilities. So we have data for renters. So in 2016, 45% of renters with disabilities lived in unaffordable housing, compared to the rate of renters without disabilities, which was 32%. Then measured again in 2021, renters with disabilities continued to fall behind, 35% of renters with disabilities lived in unaffordable housing compared to 25% of renters without disabilities. We also have information on supports and services, and I'll just quickly skip to the findings that we have at this stage, which are that les besoins des personnes handicapées en matière de soutien et d'aide à domicile restent insatisfaits. So, soutien à domicile, c'est des choses comme de l'aide avec la cuisine, l'aide à faire des courses, des choses comme ça. Donc, en 2017, sur l'ensemble des personnes handicapées ayant besoin d'une aide à domicile, seulement 33% ont déclaré avoir reçu une aide suffisante. 13% ont déclaré n'avoir reçu aucune aide. En 2022, seulement 27% ont déclaré avoir reçu suffisamment d'aide et 16% ont déclaré avoir reçu aucune aide. So as I've mentioned throughout, we've been identifying a lot of gaps in data collection across the country. And so we've identified different groups that are left out of surveys, different regions that are left out of surveys, and we've been starting to advocate for these gaps to be filled. Because if we don't have the data, how can we measure if things are getting better or worse, and for who? So we're certainly on a mission to help push for that and need others to help us in that journey as well. So finally, next step. So from the beginning of this project, we've known that the resources that we've had would be limited and finite. And so we no longer, we're unsure now the resources we can use for this project moving forward. But what we know we can do is that we can share everything we've found. So everything is going up on our website. The framework is up there. Preliminary results are going to be added over the next few weeks. And we're going to be publishing a methods report, which is for researchers so they can figure out, which surveys to go to, which questions, which section, and they can use that for their own research. And we want to share the data with the disability communities. We're going to advocate for data gaps to be filled, for policy efforts to be amended, and of course, we're going to present our findings to the UN Committee on the Rights of Persons with Disabilities when Canada is reviewed, likely in 2025. And finally, collaborate. We need to collaborate with you. We want to collaborate with you. So please reach out, and everything will be up on our website, so please take a look. Thank you very much.